Yeah. Slideshow from beginning. Okay. All right. So I can't see you all, so I hope you're all still there. So the title of today's discussion is 12-Step Program Basics for Providers. And I want to stick to the basics of 12-step programs. So this is not going to be an in-depth dive into why they work or everything about them. But we're just trying to hit on some of the bigger points that we as providers want to be familiar with. I have no disclosures for my presentation. Nobody pays me money to kind of support them or to advocate for them. Okay. And my slide won't switch. Oh, there we go. Okay. All right. So starting with some learning objectives. First thing we want to do is just discuss some of the benefits and the general background of 12-step programs. We're going to work to understand aspects that are common to all 12-step programs. I'm going to summarize a little bit of what steps are and what the 12 steps mean for people. We're going to try and anticipate some potential pitfalls and possible solutions to people who use 12-step programs, and offer up what I think are helpful suggestions for patients/clients, depending on what you call the people you help. My slide switching is going very slowly for some reason.
No worries, there might just be some lag in there, but the bottom arrows on the bottom left-hand corner might also help with that.
Bottom arrows on the bottom. Oh, hey, look at that. Thank you. That works beautiful. I'm going to use those from now on. Okay, so why are we so interested in 12-step programs? Well, 12-step programs are going to be some of the most available mutual support programs that our patients have access to. There's been some pretty good evidence showing that other mutual support programs can be helpful for people who are trying to seek recovery. But chances are many of these programs aren't going to be available in local communities, especially here in West Virginia, where we have such a rural state, rural population. So it kind of behooves us to know what these things are. And what we're going to look at here is there are some issues with 12-step programs. They're not perfect, but because they are so available, we really want to be familiar with them and be able to kind of converse about them intelligently with our patients. Okay, so 12-step programs have been reported to help millions of people. So we've got people saying that these have really helped them to get sober and stay sober. We have an evolving body of evidence showing efficacy. Quite a few new things that are coming out. 12-step programs in general have been pretty difficult to study in a rigorous scientific manner. Many of the studies are observational studies. There's a few randomized controlled trials, but they have a lot of problems. However, the next thing that is listed, where it says cost effective, that study done by Kelly is a pretty powerful study. That's from the Cochrane database, where they really looked at a tremendous amount of information and drew similar conclusions that 12-step programs do appear effective. And in addition, they tend to be cost effective for two reasons. One, they're free programs, so nobody has to pay to use a 12-step program. But also, it looks like people utilize less medical resources when they're involved with 12-step recovery. And 12-step programs provide support network for our patients with substance use disorder. So when we're treating our patients, I mean, I'm with my patients 15 minutes, 30 minutes, an hour, 2 hours. You know, unless we're in an inpatient recovery setting, we don't have that type of access to our patients. So most of the time, they're going to be out on their own. So these programs offer them support when we're not there to help them out. Okay, so 12-step programs started, all of them, from Alcoholics Anonymous. So AA is sort of the prototypical program. So this program started in 1935. And the ideas in the 12-step program were actually derived using Christian ideals. So it was derived from some of the ideas from this thing called the Oxford Group. The Oxford group was a religious movement that was trying to bring back the type of life of first century Christianity. And so the early founders of Alcoholics Anonymous took some of these ideas and tried to apply them to their problem of alcoholism. By 1939, they had about 100 members that had maintained sobriety for a couple of years. And at that time, that was rather miraculous. So they took these ideas and they didn't have meetings or programs all over the country or all over the world like there are today. So they made a decision that they were going to take the instructions for how to get into recovery and how to use their program, and they would write it down. And they wrote this book called Alcoholics Anonymous, which was published in 1939. So skipping ahead a few years to today, there's approximately 120,000 AA meetings held worldwide weekly. Narcotics Anonymous, which was an offshoot of Alcoholics Anonymous, started in 1953, and currently they have about 70,000 meetings worldwide. And I mention these two because these are probably the most common 12-step meetings that we have for our patients. These are other 12-step programs. So there are a lot of them. So people took this format and then they kind of applied it to different situations in their lives. All right, but coming through all of this, there's really three major classes. All right, so there are addictions. So there are some here that are like cocaine, marijuana, Gamblers Anonymous, apply to addictions. Also, compulsive behaviors. So the format seems to help people who have compulsive issues. And lastly, 12-step programs have been fit for support, to give support to families and loved ones of people who have addictions and compulsive behavior. So you can think of them about three different groups there. And I'm sure there are many more than this. These are just the ones I found with a quick search. Okay, so what exactly is a 12-step program and how does it work? So it's funny, today I'm doing a pain medicine rotation. I was talking to my attending there and I just let him know I was doing this discussion on 12-step programs. And he turned to me and he said, let me ask you a question. He's like, how do these programs work? And I thought about it for a second, and the most honest answer I could come up with is we're not entirely sure. We have some ideas of how they might work, but we're not exactly certain why they're as effective as they are. Okay, so just kind of interesting. So I'm not going to break that mystery today. I'm not exactly sure. But what a 12-step program is and how that part works and how it functions, I can get into that. So we're going to use Alcoholics Anonymous as a model. All right, so 12-step programs are considered fellowships. So a fellowship, as it says here, a group of people who come together on equal and friendly terms for a common purpose. So it's very democratic. There's no higher or lower members of it. It's just a group that are coming together to help one another. The barriers to entry are exceedingly low. In fact, the only requirement to join Alcoholics Anonymous is a desire to stop drinking. They used to say honest desire, but they took the word honest out. So if you have a desire to stop drinking, you can be a member of this 12-step program or any 12-step program. There's no cost to join. All right, so there is financial support that is given. It's voluntary and only members can give money to the group. 12-step programs are designed to be independent from outside groups and outside influences. So there are some aspects to the way they function that help to maintain that independence. They all end in the word anonymous. So anonymity kind of functions in a few different ways. The big idea when it was conceived was that they didn't want individual members to identify in a large public forum that they were members of a particular 12-step program, and that at that time it was Alcoholics Anonymous. So basically in media of any kind. So they say press, radio, film, but I would also say the internet. I would say giving a large talk to like tens of thousands of people, you probably shouldn't identify individually. All right, and that's really to protect the program, to protect the groups. Now, actual members also think of anonymity in the sense of not sharing who goes to these meetings, just to protect people from outside stigma or for other people from finding out that they're a part of this 12-step program. And in fact, oftentimes people only identify with their first names in a meeting. And it's for that purpose. It's just, we know there's stigma out there. And some people choose to disclose that they're members of these to friends, family, whoever. But that decision is left to individual members. All right. And finally, they come together for a single purpose. So the primary purpose of Alcoholics Anonymous is to maintain sobriety and to help other people to do the same. Okay, so they try and stick as close to that purpose as possible. So, you don't go there to get a job. You don't go there to, run for office. There's really just one simple purpose. Okay, so breaking down the parts. So we hear a lot about meetings. People go to meetings, how many you go to, different types. So meetings are just a group of people coming together for this purpose. Usually they last about an hour. Sometimes it's a little shorter, sometimes a little longer, but most of them are about an hour long. And meetings are broken down into either open or closed meetings. So closed meetings are only for people who identify as members of that fellowship or of that group. So for AA, if you identify as an alcoholic, you can go to a closed meeting. Open meetings, on the other hand, are open to anybody who is interested. And very often people who are in our field, who are training in psychology, are encouraged to go to an open meeting to sit into it to see what a 12-step meeting is like. And if you've never done that before, I highly encourage you to do that. There are different types of meetings. So they can be broken down based on following a particular piece of literature. They can be discussion meetings. Sometimes it'll be what's called a speaker meeting, where somebody comes up and shares their experience and tells their story, what things used to be like and what changed, and then what their life is like now. Sometimes there are meetings that focus on working individual steps of the program, which we're going to delve in a little bit. Okay, and there are other types of meetings. There are also specialized groups. All right, so the groups tend to cater to particular populations. So whether it's based on gender, women's groups, men's groups, LGBTQ groups, young people's groups, and there are others as well. And that just helps people to identify and to feel safer in that group so they can have a more open discussion. Meetings are certainly in person and also found online. They've been that way. However, our pandemic has moved a lot of meetings online. So that's been very helpful for our area as well because of how rural things are. It's pretty easy to get to an online meeting. You just need a reasonable internet connection, right? And people usually choose a group once they've been going for a while that they identify as their home group. All right, so this is a group that they will tend to attend more, they will do more service work there, and they just give a little bit more to that one group to help support it. Another part of 12-step programs are sponsorship. So a sponsor is basically like a mentor or a guide. It's someone that helps navigate another person through the recovery process, through the 12-step process. And people have sponsors when they're new. People have sponsors when they've been in the program for a long time. So it's not just for people that are just coming in or just learning about the 12-step program. And sponsors often change. So it's not uncommon for people, if they've been in a 12-step program for a few years, to have had multiple sponsors. So they'll use a different sponsor maybe in the beginning part as they're going and getting to know what the 12-step program is about. And then maybe they'll decide that they want to work with somebody different, maybe just work on some different skills. So it doesn't have to be one person the whole time. I put this meeting here, this picture up here. This is not from a 12-step meeting. This is from what I consider a very funny movie. And I just put this up here because we see some depictions of 12-step meetings in movies, and not all of them are very accurate. So this one is not a 12-step meeting, but just reminded me to kind of make that point. Service work is another big part of 12-step programs. So service is basically anything that helps keep the meetings going. right? So things that are considered doing service are like coming early to a meeting, setting it up, making coffee, greeting people at the door, running the meetings, cleaning up afterwards, representing your group to a larger organization within the 12-step program. And there are some other things that people do for service. And the last section of this I want to talk about is step work. So steps are where we get the name for our 12-step programs. So steps, first off, are a systematic process. Those are meant to be done in a particular order. And they're designed to engender a, quote, spiritual experience to overcome the problem of alcoholism or whatever the 12-step program is designed to help out with. Okay, and this is meant to be a guided process. This is not meant to be something that you pick up. In other words, this is not meant to be self-help. It's something that you work with somebody else. Okay. So on the left here are the 12 steps of Alcoholics Anonymous. On the right, this is how people who are first learning about the 12 steps of Alcoholics Anonymous feel about the 12 steps. It's very confusing, doesn't make a whole lot of sense. It's pretty much gibberish. And so that's one of the reasons why somebody would need a sponsor to go through this process. And this can feel very intimidating. As people read through this, it's not really clear what it is they're supposed to be doing or how this is going to help them to get their life back in order, right? So rather than go through all 12 of them, I just want to break them up into particular sections. All right, so the first section, first 3 steps, steps 1 through 3, I call those the preparation steps. And these are kind of the slower, gentler ones. These are where people are kind of getting in touch with the fact that they need help. So they need to accept their need for help. And also they're working to develop the willingness to follow through, to do what it takes to finish working the step process. They say there's only one thing you need to change when you get into recovery. That's everything. It's a huge process and it can be really daunting. So for this part, you really just want to take your time and allow people to kind of make sure that they're on the right path here. All right. So they thought these 3 steps were so important that when they wrote the AA Big Book, there's 110 pages that have directions for how to work these 12 steps. The first 70 pages are devoted completely to these first 3 steps. So 70 out of 110 pages. So they really wanted people to take their time, to really be thoughtful about this process, and to really encourage people to make sure they're absolutely ready before they move on to do some of these latter steps. I'm going to mention 12-step facilitation a little bit later. 12-step facilitation is kind of our way to get people start moving towards these first couple steps in recovery. All right. The second groups of steps 4 through 9, sometimes are called the action steps, or sometimes they're called the cleaning house process. So this is really getting down and doing a lot of analysis, taking a look at the past, looking at what's going on inside a person. These include steps like taking a moral inventory, discovery of dysfunctional character issues, and also making amends for harms that have been done while people were using. All right. Many people struggle with starting this stage of the process. So people talk about how they're starting their 4th step, or they get hung up on doing their 4th step. People get hung up because that's the part where they actually have to start looking at themselves, and it requires an actual action commitment. All right, so this could be a really tough spot for somebody, and people tend to get stuck here for a while. All right. After that, the last steps are called the maintenance steps, steps 10 through 12. And these steps are never completed. This is an ongoing process. And essentially, it's a mini version of the first 9 steps done on a daily basis. So it includes a daily inventory, building a spiritual connection to a higher power, and continuing to work to help others in this program. All right. So I believe my next slide starts getting into some of the potential issues and pitfalls in 12-step programs, and there are quite a few. Okay, the first thing, we'll just call it the God thing. All right, so So the step process, the way that it was designed, calls for surrendering yourself to a, quote, higher power. And it's made clear in the literature and in the program that this higher power is something that you come up that is of your own choosing. All right, it is a personal higher power. Nobody can really tell you this is your higher power, you must do this. In fact, all of the steps are put out as suggestions. However, the literature frequently just refers to a higher power as God. The book, if you read it, it's not hidden a whole lot. It's written from a Christian perspective. So there are many sort of Christian-based references in the book. Many meetings will just end with the Lord's Prayer, which is a prayer from Christianity. So this can be pretty off-putting for people, especially people that either have non-Christian beliefs, or people who have had negative experiences with religion, or who feel like they've been marginalized by religious groups, okay? And a lot of people that do okay in 12-step programs have these struggles early on. Some of the ways that people have dealt with this is they use the word God as an acronym. So you'll hear in AA, group of drunks, in other words, referring to the group or the program as a higher power. Sometimes you hear good, orderly direction, all right? So just being able to follow directions. And for those who are outdoors fanatics, like myself, the great outdoors is also another acronym people use to help feel connected to something larger than themselves. All right. Narcotics Anonymous, the literature is a little bit more modern. And so I put a quote here that kind of goes into their discussion of choosing a higher power or finding a higher power. And I'll just read it. It says, our understanding of a higher power is up to us. No one is going to decide for us. We can call it the group, the program, or we can call it God. The only suggested guidelines is that this power be loving, caring, and greater than ourselves. Okay. So this is a bit of a more open definition, even though the word God is still used quite a bit in their literature. It's a little bit more clear that it's not necessarily a religious thing. In fact, the program is not, it says that it's not a religious program. However, once again, there's a little bit of a disconnect there with a really strong Christian background. All right. And this makes sense if you think about the origins of the program, where it came from, and the people that were originally in it. Okay. I want to get to that in a second. All right. Another issue is, this is in particular with Alcoholics Anonymous, is that the language in the Alcoholics Anonymous Big Book is fairly dated. So the first 164 pages of the Big Book are essentially exactly the same as they were when they were written in 1939. And the world has changed a lot since then, and beliefs have changed a lot since then. So the writing assumes that the reader is a family man, not a woman, a family man, although they do say women are into the program. It's really discussed from the viewpoint or the vantage point of a family man with a stay-at-home wife. It's written for professionals, and the language is such that it's about a college level of education is assumed to read the text. And for the most part, it assumes a Christian background. It assumes a strong familiarity with at least Christian beliefs of some sort, or Christian culture. Right. The Narcotics Anonymous text is generally considered a little bit more straightforward for today's reader, so that people have a little less difficulty kind of working through the language there. And on the next slide, I just want to put a comparison of some language from the Alcoholics Anonymous Big Book that we just talked about on the left. And here on the right, this is the same quote from this little gem that you can get on Amazon for $10. It's called the Easy Big Book of Alcoholics Anonymous. And it's essentially a paraphrase from the Alcoholics Anonymous Big Book, but written in modern language. And they took out, essentially gender neutral, doesn't assume Christianity, or kind of the two big things. And the vocabulary is a little bit more straightforward. So from the Big Book, this is from talking about resentments and the 4-step inventory. The quote is, if we were to live, we had to be free of anger. The grouch and the brainstorm were not for us. They may be the dubious luxury of normal men, but for alcoholics, these things are poison. And that same line, paraphrased, is that normal people can get away with anger, but for us, it's poison. So I like this idea a lot. It can really just take something that, the grouch and the brainstorm, I'm still not sure exactly what that means, but they capture the biggest ideas from that. And this can be helpful for somebody who's really struggling with, reading the literature, reading the text. Okay. Other issues. So not everyone is there to get well. Or as I've heard it said, not everybody in a 12-step program is a bastion of mental health. All right. So these are sick people that have come together to try and work on their issues. All right. And you will hear things in meetings. For example, one of the things that you can hear from time to time in Alcoholics Anonymous meetings is that you can't talk about drugs in Alcoholics Anonymous, which that issue was actually addressed in the past. And there is no rule that says people can't talk about drugs in Alcoholics Anonymous. So that's one example. When I hear people say things like that, I tell them to ask them, if I'm not drinking alcohol, but if I'm using heroin, does that mean I'm still sober? Because obviously it doesn't. All right. Obviously it doesn't. So, but your patients can hear this and it can really make them feel unwelcome or feel like they don't belong. And then they're not going to be getting the help that's available to them. People have been known to sell drugs at meetings, Narcotics Anonymous meetings in particular. Okay. And there's things like what's called 13-stepping newcomers. So remember, there were only 12 steps. So a 13th step is when somebody who's brand new in the program is approached romantically by somebody who's been in the program for a while. It can be pretty destructive and can lead people to leave the program when things inevitably don't go well, almost inevitably don't go well in the end. So it's predatory behavior. And sometimes people that have been in a program for a while, if they see that happening, they'll actually address it individually with people, because once again, it can threaten somebody's recovery. So some things that you'll hear to deal with the kind of different people in these programs. I don't know, somebody, yeah, good, thanks. So you'll hear the saying like, stick with the winners, or find people who have what you want. It's helpful to encourage people if they have these complaints about the people that are in the program and they're coming back and telling you about that. You really want to encourage them to look for people that seem like they have some sanity in their life, that seem relatively happy, so that they can then stay with those people, so they can kind of emulate what they're doing. Or if you really don't like the meetings you're going to, try different meetings, because meetings have different personalities. Okay. I think this is the third issue. All right. So this issue, I just want to make everybody aware of this. So Narcotics Anonymous puts out a position statement on medication-assisted treatment, or medication for opioid use disorder. Without reading the entire statement, these are actually taken from two separate pamphlets that Narcotics Anonymous publishes. So the first pamphlet is talking about medication-assisted treatment, and I'll just read the stuff in blue. It states that NA, or Narcotics Anonymous, is a program of complete abstinence. Then they say, by definition, medically assisted therapy, in other words, medication for opioid use disorder, indicates that medication is used to treat addiction. In NA, addiction is treated by abstinence and through the application of the spiritual principles. All right, so it's not outright stated, but it's very strongly implied that if you are on medication for opioid use disorder, you're really not working that program the way that you should. It's inferred, it's not outright stated, but it seems pretty clear to me. An interesting piece here is that this lower quote talks about people being on medication for chronic pain. And so what it says here essentially is that perhaps you're in chronic pain and your doctor has prescribed some medication that is also used to treat opioid use disorder. As long as you're taking the medicine for pain, and you're not taking it to treat your addiction, that's just fine with us. So, and this is the organization as a whole. All right. Now, there are plenty of people that utilize this program that are a lot more open-minded to medication for opioid use disorder. We know that it saves people's lives, and that's why we do it. It's based on we use it because of clinical evidence. However, you may want to encourage your patients not to disclose openly that they're taking medications for opioid use disorder if they're going to be members or to utilize Narcotics Anonymous program. Okay, it's just something important to keep in mind. All right, so how can we help our patients navigate all of this? There's a lot of stuff for people to navigate. All right, one of the most powerful tools that we have to help people navigate 12-step programs is something called 12-step facilitation. And for those who aren't familiar with this, it is a standardized treatment, lasts for about 6 to 12 weeks, that introduces clients or patients to 12-step programs and helps them along the process of working those first couple of steps. All right, so really understanding and starting to see the consequences of their use or their addictions, and starting to see their need for help. In addition, they also encourage people to attend meetings and to get involved in 12-step programs. And the evidence shows that for really systemized 12-step facilitation, that tends to work best for patients who are going to use 12-step programs. In addition, having a warm handoff. So having somebody who is experienced in 12-step recovery meet with our patients to talk to them about the process, about where they're at, is extremely helpful. And people who have had these experiences that get transitioned to somebody who's already involved tend to stay sober longer. All right, so we have recovery coaches, and not every place has recovery coaches, but if you have recovery coaches, they can be a really amazing tool. And if you don't have recovery coaches, sometimes the 12-step community can have people that will be willing to come and talk to other people that are struggling or considering starting a 12-step program. What I like to do, I don't like to get too deep into 12-step programs with patients, but it's nice to have something that you can say to them about it. All right, so we don't have to, know everything about 12-step programs. This is a paraphrase of my elevator pitch. It's pretty simple. It's that we tend to see that people who do utilize 12-step programs, they just tend to do better than people who do not. All right, pretty simple. Maybe oversimplified, okay? But when somebody's asking about it, that's what I want to tell them. And I'll let them know that there is some pretty good evidence that this can be helpful for their recovery. Okay? Other things that we can do to help our patients, just ask questions during your medical encounters or during your therapy encounters. Just ask questions, do you go to meetings? Do you use these programs? If not, what do you do? And I usually start really general. Like, I don't assume that they're going, just say, hey, have you done this? Have you been to these? And if they're like, oh yeah, I go to this meeting, say, really, like, how's it going? And you can just ask, more questions to kind of get a sense of, how far into a program somebody is or how willing they are to give it a try. If somebody has actually got connected with a 12-step program, they'll tell you all about it. They'll tell you, everything, the group, this and that. They'll talk about the problems. They'll talk about the things that are going well with them. So you won't really have to push people really hard. But I just like to mention it to people to let them know that that is a big part of their recovery. If they're willing to use it. Yeah. Okay. A few helpful suggestions for patients. It's often suggested that people, when they're first going to 12-step program, attend 90 meetings in 90 days. And that's what 90 and 90 means. And we have some studies showing that the more involvement that people have in a 12-step program, the less likely they are to return to use within the first year. So involvement includes not only going to meetings, it includes some of these other things. Having a sponsor and utilizing a sponsor is one of the biggest predictors of somebody remaining substance-free at 12 months. So that's another big part. I encourage people to try different meetings. So the meetings can be pretty different. And so you don't really know what's out there until you try. So just encouraging people to kind of open up a little bit once they're comfortable enough to do that and to try some different meetings to get a different flavor. When it comes to getting a sponsor, if people that are new, especially, have a very difficult time asking somebody to be their sponsor. The sense is that, oh, I'm imposing on this person. And if people will describe it as feeling like, oh, I feel like I'm asking somebody to marry me, like I'm proposing to them. So I just suggest to them, ask somebody if they can be a temporary sponsor, somebody who can kind of step into the gap. So it's a little bit of like try before you buy or rent to own, but this can make it less intimidating. And ultimately, the only thing that matters is that they do it. So if they pick a temporary sponsor, you know, at least they're kind of starting that process moving in the right direction. Participation is really important. It can be very tempting to be very passive when attending 12-step meetings, 12-step groups. And people that are really passive, they tend to stop coming. So people get bored if they're really passive, if they don't talk, if they don't share. That can lead to boredom. All right, and boredom can lead to saying this isn't worth it. Acting as if is another suggestion that can be really helpful for people. So there's a saying in 12-step program says it's easier to act your way into right thinking than to do it the other way around. So people can get stuck thinking about why they should or shouldn't do something or trying the paralysis of analysis for a long, long time. Where it doesn't really matter why it works. The point is you just want to get moving in that right direction. As they say, bring the body and the mind will follow. Frustration is to be expected. You know, recovery is not easy. The earlier somebody is in recovery in general, the more frustration, the more setbacks, the harder this tends to be. So treating frustration as training or as an opportunity to learn or to practice some character building or spiritual principles, if you will, can be really helpful. A big part of the 12 steps, I believe personally, is just paradigm shifting. It's a cognitive reframing of what's going on in somebody's life. A lot of the same stuff that we do with cognitive behavioral therapy, a lot of that takes place in 12-step programs. I encourage people to practice asking for help. Asking for help can be extremely difficult early in recovery. So I just frame it in the terms of practice. Why don't you practice asking for help? You know, tell somebody what's going on or see if somebody can help you rather than trying to take your problems on all by yourself. And if somebody has severe social anxiety, they can have a really hard time, like putting themselves out there, walking into a room of strangers they've never met, introducing themselves. That can be really daunting. But online meetings, I know I said people shouldn't hide on the side, but online meetings, as you know, with online meetings like this one, you can kind of hide in the background. All right, you can be a bit of a spectator for a while. And if somebody has severe social anxiety, that may be one of the better options. I'd rather have them do that than to not have any contact with mutual support. Okay. So these are some potential helpful suggestions for people. All right. So in summary, 12-step programs are the ones that are most likely to be available as far as community support or mutual support groups in patients' communities. So these are the ones that our patients are going to have the most access to. There are plenty of other mutual support groups out there. Some of them have evolved from people trying to solve some of these issues that we saw with the 12-step programs. For example, there are secular mutual help groups where they don't bring any kind of spirituality into it. So there are plenty of things out there. And so far, the evidence, what it looks like is people tend to self-select for a program that works for them. So, if somebody self-selects, for example, for Smart Recovery and they're engaged in it, as long as it's abstinence-based, they tend to do about as well, as people in 12-step recovery. Once again, the evidence isn't as strong for that, but it's looking like those things are coming online and they do appear to be pretty equivalent. All right. There's pretty clear evidence that shows that using 12-step programs is superior to not using 12-step programs. They provide social network, and they also provide some long-term social retraining. So if you've been through the process and watched somebody early in recovery or maybe at rehab in the early kind of days, social skills, they tend to get out of whack when somebody has a substance use disorder. So it takes time for those things to get kind of retrained in. So 12-step programs can really help people to develop those types of social skills. It's extremely cost effective, all right? It's essentially free. And people use less medical resources, they tend to, if they're involved in 12-step programs. There's a lot of potential pitfalls to 12-step programs, but there are also ways to lessen their impact. And the last thing, just ask people how the recovery is going. Engage in that conversation. Asking some open-ended questions to start with can be really helpful. Just let them talk. You'll get a sense of what their attitude is or if there's a problem. And if you know a little bit about 12-step programs, you can maybe ask a question or make a simple suggestion to them. We have authority with our patients. They will tend to trust us, especially if they have an ongoing relationship with us. So, if we can utilize that to help them get through something that may keep them out of participating in these recovery programs, that could be really helpful for them. All right, that is my last presentation slide. Just to prove to you that I didn't make all this stuff up, there are a couple things of references in the back. And that is it for the presentation part. And open it up for if anybody has any questions. I'd be happy to do my best to answer them.
Thank you so much, Dr. Reynolds. First and foremost, we wanted to thank you for doing your first ECHO presentation. It was awesome. I really enjoyed the really detailed aspect of the 12-step program. And I personally enjoyed the origins and the history aspect of it. So thank you for including those. We did get some chats and saying, nice job, awesome presentation, and thanking you. So yeah, we'll open it up for any questions, comments, or thoughts that anyone wanted to share with the group. So feel free to unmute, chat in.
We're going to make a statement. One of the things that I think is extremely powerful about mutual support group meetings is that a patient who is early in recovery meets somebody who's successful, and it inspires them. It makes it believable that they can change their life, when they see people succeeding. And I think that really could relate to any medical problem. I'm not sure we should limit this model just to maybe not the 12 steps, or I think that's optional really as far as meeting someone who's successful. But the power of meeting someone who's successful, I think, is really important in recovery from medical problems. What do you think, Mike?
I agree. I always agree with you, Dr. Hersler. Yeah, I mean, I think seeing somebody there, especially early in recovery, being very discouraged or maybe thinking about this isn't worth it. Maybe I should drink, or maybe I should go get high, or, maybe I'll go hang out with some of my old friends because I'm a bit lonely and I miss it. I don't know if I can do this. Just having somebody, even telling somebody or seeing somebody that's got even an entire year of sobriety, that seems like forever to somebody who's first coming in, who's, maybe has a month. So yeah, I absolutely agree. Just seeing what is possible can encourage people to put in the effort.
For patients who sort of are hesitant to try, what, in your opinion, and for anyone else, what is a really good way of reframing I don't want to go there and just listen to everyone else's problems. What do you all say to that?
I'm
I
sorry.
need an idea.
So if somebody's hesitant because they don't want to hear other people's stuff.
Yeah, like sometimes when I'm trying to engage patients and have them try a group, try 12-step, and they're like, oh, just a bunch of people sitting around talking about their problems. I don't want to do that. And I know that's not what it is. I've gone to them, but I don't know a good way to reframe it or say it in such a way to help them overcome that barrier.
Yeah, well, that may have been their experience, if they went to a 12-step program. So, I mean, I would say, yeah, sometimes people just come in and they just complain about their problems and they don't really change. But you can try other meetings, you can try other groups. I guarantee if you try a few of them, that should not be your experience. Now, it could just be that somebody just wants to see that. And, that certainly could be their experience early on, but I would just say, keep an open mind, why don't you try something a little bit different, try to go to a different one. Or look for people there who seem really calm and centered and maybe go talk to them afterwards. So you get their vantage point on it. That's a great question.
Thanks.
Yeah, I mean, a lot of times our patients, when I ask about it, they're like, no, I don't like those don't work for me. They're pretty dismissive. And so, I mean, I'll probe a little bit with that, but if they're really shut down on it, I'll just leave it at that and kind of wait a little while and maybe bring it up a little bit later to see if their feelings change. So, or if they don't like 12-step programs, I would ask them to check out some of the other mutual support programs. We don't want to limit somebody. If they have a big issue with one type of program, try something else.
Yeah, I was just going to mention there's Refuge Recovery for folks who kind of struggle with the God thing. And then for people who really are drawn to kind of a Christian experience, you guys probably have heard of Celebrate Recovery. And Celebrate Recovery is very family oriented and often doesn't discriminate around whatever substance you're struggling with, or even substances versus process addictions. And so they seem to often, patients report that they, feel more inclusive. They often have childcare and food. And so it's those meetings tend to have a real community feel to them based on the reports that I've had from patients who go and really enjoy them. So there are a lot of options.
That sounds fun. Laura, you just reminded me of something else. So with, for example, Alcoholics Anonymous, there are groups for family members. So like AlAnon is for family members or people that are close to the alcoholic or Narcanon. And I think also that can be helpful as long as family is open to the idea. Of maybe getting some support there, because people don't live in a vacuum, right? They go home to their family, and so if the family has some support in dealing with their sick family member, it can be really helpful. Hasn't been studied a whole lot, I don't think.
Yeah, the research that I'm aware of is that when patients and family members are both in peer recovery support, they tend to do better, and also. Someone was asking about, how do you sell this to patients? I run a multifamily group as part of our ROP, and it's always encouraging the patient to say, you can hold your family member accountable by recommending that they go to these meetings while they're bugging you about going to your meetings. And the idea is that it helps the family member focus on their own recovery instead of focusing on their loved one's recovery and getting, overly involved or trying to engage in control behaviors.
Thanks, Laura.
Thank you for the presentation. I was shocked to see that it's actually in writing that Narcotics Anonymous supports an abstinence-only approach to recovery. I mean, I always thought it was more based on the individual who led the particular meeting, and I want, and then the other quote you had from there was pretty recent, 2020. I wonder if there's any thought that that might evolve to be more accepting of medication-assisted therapy over time. And my other comment is that I thought it was, and it may be because of that, I thought it was a little bit unfortunate in that TV show Dope Sick, based on Beth Macy's book, that they really, I thought, threw Narcotics Anonymous under the bus, and there's some pretty negative portrayals. I mean, I was glad that you addressed all that today. But anyway, any thoughts on whether or not their thoughts as an organization might evolve on that?
We can hope. I think individual members or clusters of people that are members don't necessarily share the formal view of the overall program. My sense is that that idea is fairly entrenched. So I wouldn't hold your breath to wait for that to change anytime soon. But I think, I mean, there are plenty of people, obviously, that utilize Narcotics Anonymous that are on Suboxone or on methadone. So, you know, I just encourage patients just to be, you know, to understand that. And I certainly have had patients that were, you know, experienced a lot of discrimination and stigma because they were on medication. So, yeah, I wouldn't hold my breath. I mean, they haven't changed the first 164 pages of Alcoholics Anonymous Big Book since 1939. So these things tend to get fairly entrenched. And the idea behind that is like, well, it's worked so well, if we change it, we might break it, you know, but yeah, sure, that's an argument, right?
Thanks.
I just had a thought, Mike. If you think about it, when NA came out, there was no methadone, there was no anything for 20 years. So at the time, it really, I've heard it said, you know, opioid use was a hopeless disease.
Right.
So it was really the only thing they had. So there was nothing for them to kind of base off of, where at least you had like some idea of treatment a little bit with Alcoholics Anonymous, this detox and things. I remember one time I talked to somebody who's big into NA, and I asked them what they had against medicine. He's like, recovery is about suffering, and you're not suffering if you're on medicine. I'm like, most people don't like to suffer all the time. So yeah, that always stuck out to me, is suffering. So
Yeah.
But yeah.
Yeah.
Sure.
To follow up on that comment, Jeremy, I think, you know, coming from a Christian background and, you know, even from Catholicism, that suffering's kind of the way to healing for a lot of people. So I think that's built into it. I do think there's probably something to be said about, you know, as I was going through med school, what do you do for alcoholism? You give them the 1-800-AA number. That's kind of what we had, the same way with NA. And so I think, you know, for a long time, it was all there was. And then even in medicine, you know, we had many, many times we really didn't know how to approach any of this besides, you know, methadone, and that was it. So I think as we develop treatments now, it's how do you integrate that? Definitely groups. We've done groups in our family medicine practice for diabetics, hypertensive, you know, and those work great. There's something powerful about people in groups and the group we're leading itself. You know, I just wonder how much, you know, what's the therapeutic end. Obviously, if you do more of it and it doesn't cost anything, that's good. I mean, somebody who's committed and going 90 days is very different than, but are the coat groups enough once a week? You know, it's a question, you know, what's the minimum therapy, or, you know, that somebody needs. And I don't know, our groups don't always emphasize the 12-step, and people definitely, some go, but a lot don't. And I think they do fairly well. So it's a question. I don't think it's denying that it works, but I think there are other paths for other people as well that we need to keep open. And there's a lot of excuses for our patients, you know, when they go, oh, I don't want to talk about my problems. They don't want to talk about their problems in coke group. They say, I'm not really like the rest of the people in this room. We've all heard that, you know, all those kind of things. And so there is a lot of denial that needs to be worked through from the beginning.
Yeah. Thanks, David.
Thank you all so much for the comments, the questions, and sharing your experiences. This has been a wonderful discussion and a wonderful session. So thank you all so much. Were there any final thoughts, questions for the group before I go into the announcements? Alrighty, well, as usual, I'll attach these slides to the recap email My only announcement is that our next session will be on January 24th, and Laura Lander will be presenting on pregnancy code. So keep an eye out for that reminder. Shoot us an email anytime if you have questions, and we'll see you all next time. Thanks, everyone. Take care.
Hi, everyone.